The virus outbreak now, and scientists in the US and Korea have been working with Moderna to develop a virus. The company's shares gained 14% since this latest outbreak began. Moderna says the vaccine research is early. The question is whether a vaccine would be profitable. Health authorities say the risk is low, and some analysts say there's no money to be made from it all. Now, Asel Sartbaeva is a chemistry professor at the University of Bath, part of a team of scientists working to create the virus, or hantavirus, joins me now from Bath. Professor, good to see you, ma'am. Thank you for joining us. I think the question, first of all, is why haven't we had a vaccine before? Is it simply too difficult? Is it not likely to be a profit? But what's the reason, do you think?
Good evening. Thank you for inviting me. What's the reason why we haven't had a vaccine before, the specific one? Well, the simple answer is it's a neglected disease. It's a very rare disease. So it's probably has been seen by companies as a non-profitable vaccine to develop.
And the work that you're doing towards a vaccine or towards treatment, how is it coming along?
So my team at a company called Insilitech here in the UK, together with two other teams, one in Texas at UTMB and the other one at Afrigen in South Africa, are working in partnership, and we have developed a new vaccine, a new antigen against hantan diseases. So hantan is one of the hantaviruses. It's slightly different to Andes, which we're seeing at the moment, but it's still within the same group of viruses. So they're very similar.
Right. So this thing already exists, and arguably, you know, if it had been given in advance, might it have prevented? I'm not saying that there would have been any reason to give it in advance, but if it had been, might it have prevented this?
Very good question. So we've only developed an antigen, so there isn't really a vaccine yet. It's efficacious at the moment. What we have developed has been tested in the lab and in animal models. It hasn't been rolled out to general public yet because we haven't done the clinical trials yet. So we are still in development. But what we're hoping for in the future is that once we've done all the clinical trials and it has been approved, that we're hoping that it will be rolled out to general public, and then people hopefully will be prevented from contracting it.
So who would take it? I mean, I guess if you were living in an area known to be endemic with it, you might take it. But let's just for argument's sake, if you were going on this cruise and you were going on a Latin Central American trip or where, you know, would you suggest taking that sort of virus? A vaccine? I don't know.
That's a really good question, Richard. Absolutely, there are a lot of vaccines already out there which people take just before they go to travel somewhere, and this could be one of the vaccines in the future. What's really great about this vaccine is that you see the technology which we've been developing at Insilitech is a thermally stabilizing technology, which means that what we are trying to create is a completely new vaccine plus a thermally stable vaccine. So it's a vaccine which will not require refrigeration or freezers in the future. So we are hoping that people all around the world will be able to receive that vaccine easier, and then we will have more people vaccinated.
Your best guess scenario for when you might think your vaccine or antigen would go into the first arm? Roughly, I won't hold you to it. I promise I won't hold you to it. But give me a rough idea of when realistically it might happen.
Thank you, Richard. Yeah, so we're hoping that the first vaccine will go in the arms during the clinical trials, and that can be very, very quick within next year. But for general public, we're thinking 3 to 4 years approximately from now.
Just got to make sure you don't catch it in the meantime. I'm very grateful to you, Professor. Thank you for joining us tonight, Questions Business.